Racial, ethnic, sex, and income disparities in overall survival in chronic lymphocytic leukemia patients in the era of targeted therapies, surveillance, epidemiology, and end results, or SEER registry analysis for the 10 years between 2009 and 2019. Hi, I'm Dr. Brian Koffman, the co-founder, Chief Medical Officer, and Executive Vice President of the nonprofit CLL Society. In the way of introduction, the annual meeting of the American Society of Hematology showcases not only the latest breakthroughs in hematology, but also important research on how societal issues affect how healthcare is actually delivered. In recent years, including in 2022, concerns about disparities have been highlighted. In this abstract, racial, ethnic, sex, and income disparities in overall survival, or OS, in chronic lymphocytic leukemia, or CLL, CLL patients in the era of targeted therapy, surveillance, epidemiology, and end results, or SEER for short, registry analysis, 2009 through 2019, we learned we still have work to do to address disparities. What was the bottom line of this paper? Non-Hispanic blacks, males, and those with lower income with CLL have higher death rates compared to non-Hispanic whites, Hispanics, females, and those with higher incomes. Who performed this research? This research was reported at ASH 2022 and used SEERS data. SEERS refers to the federal government's surveillance, epidemiology, and end results, or SEERS results. This information is available for all free online, and we share the link on the website. Let me provide the background. Prior research at the Veterans Administration, VA, and others have reported on disparities in chronic lymphocytic leukemia care based on race and socioeconomic status. But there is a need to update this data in the era of improved outcomes with the use of targeted therapies such as ibrutinib, acalabrutinib, zanubrutinib, and venetoclax. What was the method the authors used? The authors analyzed the SEERS registry for patients diagnosed with CLL between 2009 and 2019 to see what the association was between CLL-related mortality and race, ethnicity, sex, and socioeconomic status. SEERS data was collected for anyone over the age of 15 with CLL confirmed by a pathologist between those years of 2009 and 2019. They extracted the data to look at the age of diagnosis, the sex, the ethnicity and race, non-Hispanic white, non-Hispanic black, and Hispanic, and household income at various different levels, and also whether the patient lived in a rural or urban area. Let's review the results. A total of 32,701 patients met the eligibility requirements for this study, and as we'd expect, there were more men than women, 61% male, 39% female. The overall survival was significantly better among women than men. Again, this is not news. The overall survival was also significantly better in non-Hispanic whites and Hispanics when compared to non-Hispanic blacks. Overall survival was significantly lower in patients at the lower ends of the annual income when compared to those at the higher ends of the annual income, and we give details on the website. What was interesting was that urban or rural residents did not seem to make any difference in overall survival, which is different than what we've seen in the past, where we've seen CLL was more common on people living on farms and such settings. So what are our conclusions? We learned that men, non-Hispanic blacks, and those with incomes at the lower end are more likely to die of their CLL, and that surprisingly, rural versus urban location does not lead to poorer outcomes, but we really don't know why all these differences exist. We can speculate. Is disease biology different in men? Is it different in non-Hispanic blacks? Do these groups present later with more advanced disease? Is their treatment delayed or different? We urge our non-Hispanic blacks to consider the Mayo's clinical trial, and we provide a link for that is trying to answer some of these questions by looking at the biology of CLL and looking inside those cells for these answers in different ethnicities. At the same ASH meeting, we got a hint of one possible factor, the biomarker of telomere lengths. From this study, chronic lymphocytic leukemia in African ancestry population is characterized by increased telomere erosion. Regardless of how much of this is from genetics and how much is environment, whatever it is that contributes to this poorer outcomes, we must work to ensure that all CLL, SLL patients are getting their best possible care. We provide links to the actual abstract, racial, ethnic, sex, and income disparities in overall survival in chronic lymphocytic patients in the era of targeted therapy, surveillance epidemiology, and end results, Sears registry data 2009 through 2019. Thanks for your attention. Stay strong. We are all in this together.